Good morning, all of you. So, today's class we are going to study about the signal average ECG. So, what is meant by signal average ECG? It is not like an ordinary ECG in which we'll be connecting the electrodes and getting the ECG signal. So, here we are taking the multiple electric signals from the heart and we are averaging to remove any interferences which is present in the signal. So the small variations in the QRS complex also it can be revealed in this particular signal average ECG. So which is the small variation in the QRS complex we call it as late potentials. And sometimes this signal average ECG is mainly useful to predict any dangerous ventricular tachyarrhythmias which is present in the signal. So if you see the signal average ECG electrocardiogram, so the procedure is we will ask the patient to lie on the table and connect the electrodes and record this ECG signal for a period of 20 minutes duration, and you will be getting a multiple ECG tracings here. So mainly we are using this to capture any abnormal heartbeats which may occur intermittently. So for that purpose only we are using this signal average ECG. So here the computer will capture all the electrical signals from the heart and it will average them so that any noise which is present will be eliminated. And this signal average ECG mainly used to assess any arrhythmias or any dysarrhythmias, irregular heart rhythms is present in the certain medical situations. And if you see, there are so many methods in which we can able to record the ECG signal. One is resting ECG. By connecting 12 standard ECG lead system, we can able to acquire the resting ECG signal. Then Holter monitor is there in which you can able to see in the hospitals the leads are connected to the subject. In the monitor you can able to see the ECG signal is displayed. That is the Holter monitor. Then we have exercise ECG. So I think we'll be placing the electrodes over the chest leads, and then the patient will be asked to stand on a treadmill or something. While doing the exercise, we'll measure the ECG signal. So that is called the exercise ECG. Then cardiac catheterization. So during that cardiac catheterization process, in that case, we'll be acquiring the ECG and check it. Then the next one is by using chest X-ray or computer CT scan of the chest or echocardiography, we can able to get the electrical activity of the heart. Then MRI of the heart and myocardial perfusion scans, radionucleotide angiography, ultrafast TD scan. So these are some of the procedures which is related to assess the heart performance. So here the procedure for to acquire the signal average ECG is, so first the patient will be asked to lie in a supine position. Then a specialized software, the signal average ECG software is there. So the technician will connect the that is the system, the ECG machine to the subject using the lead system. Then the ECG signal will be recorded for a duration of 7 to 10 minutes duration, so that multiple ECG signal will be recorded. And once it is recorded, when we average it, we can able to remove any interference which is present in the signal. So it is very important that the patient should lie in a supine position so for possible for recording the signal average ECG. Then what is the significance of the signal average ECG? So we can able to predict the late potentials or due to delayed potential due to the depolarization of ventricular myocardium, or we can able to identify any risk or dangerous situation due to ventricular tachyarrhythmias. You know that tachyarrhythmias means the ventricular will doing the pumping action very faster rate. So that is why heartbeat will be very high in the case of tachyarrhythmias. And then this signal average ECG is used to identify any risk associated with a sudden cardiac death in people who had some myocardial infarctions. And then so any other applications, the signal average ECG is used here. So using that, the people have done some research in that they identify the late potentials. It may found around 0 to 10% in case of normal volunteers also. And in the case of ventricular tachycardia, so the researchers yield a sensitivity of 72%, specificity of 75%, positive predictive value of 20%, and negative predictive value of 20%. And what is the advantage of signal average ECG is the filter ECG is used to detect any low amplitude potentials and to identify any myocardial scares which is present. So this will create the zone of slow conduction in which we can able to get only the low amplitude late potential signals. And then the late potentials signals may be from the scar within the scar. Sometimes it may not be detected using SA-ECG signal. So in the case of bundle branch block, so you can able to see the right bundle branch block, left bundle branch block. So this bundle branch block, it relays the depolarization ipsilaterally to the site of block. So the delayed conditions may due to the late potentials which is here on the as a, on the SA-ECG signal. Then what is the criteria for finding out the abnormal SA-ECG is, the criteria is if you have the signal average ECG signal, the first thing is we have to calculate the root mean square voltage of the terminal. So which should be 40 milliseconds in duration, is less than 20 microvolts in amplitude. So this shows that the low voltage potentials late in ventricular depolarization and reflect the depolarization in slowly conducting scars. And the second point is the total QRS duration should be greater than 114 milliseconds. And the third criteria is the duration of low amplitude signal should be less than 40 microvolts and it should be greater than 38 milliseconds in duration. So here the researchers have conducted the study and identified the negative predictive value of this signal average ECG is 97% and the positive predictive value is only 20%. So this test is mainly used for to find out the negative test results which makes the ventricular tachycardia as a cause of syncope unlikely. So in this SA-ECG recording, so we can able to get the signal average ECG signal. So it can be printed as a like a standard ECG signal. It can be printed because the software associated with it. So here we can able to identify any late potentials or any late ventricular potentials more accurately, and we can able to interpret the results with some cutoff values. Thank you.